46-year-old female found lying outside the passenger door of her car on the side of the expressway.
Okay, BSI scene safe.
It is.
How many patients do I have?
One.
All right, what's my mechanism of injury?
Car versus tree, possible ejection.
Okay, I'm gonna go ahead and put ALS on standby. Partner, would you take manual stabilization, please? What's my general impression when I come up?
Unconscious as you see her laying with a small pool of blood at the head.
Okay, since you already told me unconscious, I'm gonna check for consciousness anyway.
She is unconscious.
Okay, noted. Do I see any severe life threats?
Just a small pool of blood behind the head, nothing else noted.
Okay, noted. I'm gonna go ahead and open the airway and check the airway. Do I have an open patent airway?
You do. How do you open an airway on a trauma patient?
I'm gonna go ahead and use a modified jaw thrust.
Thank
Have my
you.
partner take care of that. I'm gonna go ahead and put an OPA airway in to maintain patent.
What's the contraindication?
Gag reflex present.
Yeah, no gag reflex. Continue.
All right, I'm gonna go ahead and check for breathing rate, quality, and character after I expose her chest.
26 times a minute, rapid and shallow.
Okay, noted. Do I see any airway injuries need managing?
None noted at this time.
Okay, noted. I'm gonna go ahead and place my partner, a patient on 15 liters a minute, high flow, 12 breaths a minute with a bag valve mask.
She can tolerate. Continue.
I'm gonna go ahead and check for pulse, carotid versus radio.
At present,
Do I see any severe bleeding as far as the head, the torso, and the legs?
you do see some lacerations on both arms that are visible, but minimal bleeding.
Okay, noted. We'll address that later. Go ahead and check for skin color, temp condition.
Pale, cool, and diaphoretic.
Okay, noted. I'm gonna go ahead and treat for shock, basically as far as anything we've been doing as far as this maintain body temp, cover up, and we're gonna go ahead and do a rapid transport. She is a high priority patient based on unconscious.
Continue.
Okay, thought I screwed up. All right, we're gonna go ahead and start my full body head to toe examination. We're gonna go ahead and start at the head. DCAT, BTLS, tick, deformities,
Stands for?
contusions, abrasions, punctures, penetrations, burns, tears, lacerations, swelling, tenderness, instability, and crepitus. I'm gonna use the palms of my hand. Do I have any blood? Do I have any step-offs?
You do. You
Impressions?
notice a 3-inch laceration to the top of the head.
Okay. How's the bleeding?
It is under control.
Okay, noted. At this point, we'll come back for it. I'm gonna go ahead and check the neck. DCAT, BTLS, tick. Do I have any step-offs, blood?
Noted.
Okay. I'm gonna check for JVD and tracheal deviation.
They are flat in midline.
Noted. I'm gonna go ahead and place my patient in a manual C-collar at this point.
Continue.
I'm gonna go ahead and expose the rest of my patient at this point. I'm gonna go ahead and check the chest as far as knife and sternum. I'm gonna go ahead and check the ribs, DCAT, BTLS, tick.
Nothing noted.
I'm gonna go ahead and auscultate for breath sounds, mid-clavicular, mid-axillary.
Lungs are clear and equal bilateral.
Okay. I'm gonna go ahead and check the belly, DCAT, BTLS, tick. I'm gonna check for distension, rigidity, and guarding.
Other than abrasions, nothing else.
Okay, no
Bleeding
firmness.
minimal.
Okay. I'm gonna go ahead and check the pelvis in and down,
Pelvis is stable.
DCAT, BTLS, tick.
It's stable.
Okay.
Nothing noted.
I'm gonna go ahead and check genitalia, DCAT, BTLS, tick.
None noted.
Okay. I'm gonna go ahead and check for distal pulse, DCAT, BTLS, tick on this leg.
Pulse is present.
Okay, do I have
and
sensation?
noted. Present.
Be easier to spin the patient around. DCAT, BTLS, tick this leg. Do I have
Nothing
distal
noted.
pulse?
You do.
Do I have sensation?
You do.
Go ahead and check this arm, DCAT, BTLS, tick.
Multiple lacerations. Bleeding is under control.
Okay. Do I have pulse?
You do.
Do I have sensation?
You do.
DCAT, BTLS, tick. Do I have pulse?
Multiple lacerations. You have a pulse,
Okay.
and you do have sensation.
All right, noted. All right, we're gonna go ahead and log roll the patient onto a board on my partner's count.
1, 2, 3.
Okay, we'll go ahead and check the spine. Do I have any crepitus? Do I have any blood?
Notice multiple abrasions to the posterior, but everything's under control.
Okay, noted. All right, we'll go ahead and down on your count.
Onto a longboard.
All right, we're gonna strap my patient to longboard. Chest, pelvis, chalk and block the head, legs. You can let go of C-span. At this point, we're going to go ahead and do a sample history. Can anybody give me a sample on her?
They saw a deer run out in front of her. She swerved and hit the tree and got out of the car and hit the ground.
Noted. All right, we're en route to the hospital at this time. We have her loaded. We're gonna start off by having my partner get a baseline set of vitals.
118/60. You know the heart rate and you're controlling with BVM.
Okay, noted. I'm gonna go ahead and start off with a, change with the ABCs.
None noted.
Okay. Go ahead and start off with a detailed assessment. Go ahead and recheck in the head anything we missed. Do I have any blood depressions?
Still a 3-inch laceration to the top of the head, nothing else.
Okay, I'm gonna check the zygomas. I'm gonna check maxillary mandible.
Nothing noted. You do start to notice a strong odor of alcohol.
Okay. I'm gonna go ahead and check the eyes for pearl.
They are.
Okay. I'm gonna check the mouth for teeth alignment or any type of obstruction.
None noted.
Any fluid in the ears or nose?
None noted.
Raccoon eyes or battle sign?
Very good.
Okay.
Pearl stands for.
Pearl stands for
People's equal and round reactive delight.
continue.
I'm gonna go ahead and check the trachea. Is it midline?
Still midline.
It's one that I can check on the neck right now since I have a collar on. I'm gonna go ahead and check chest, decap BTLS tick, starting with the scapulus, clavicles.
Noted.
Okay. Go ahead and light the sternum.
Still good.
Go ahead and check the ribs, decap BTLS tick.
Still good.
I'm gonna re-auscultate mid-clavicular, mid-axillary.
Lung signs are still clear and equal bilateral.
I'm gonna go ahead and check the belly, decap BTLS tick, rigidity guarding distension.
None noted.
Okay, no firmness.
None noted.
Okay.
Just the abrasions.
Go ahead and recheck the pelvis. Stable,
Still
decap
stable.
BTLS. All right. Go ahead and check the leg, stopping at patella, decap BTLS tick. Do I have pulse?
You do.
Sensation.
You do.
Go ahead and check this leg, decap BTLS tick, patella.
You're good.
Do I have pulse
You do.
and sensation?
Still do.
All right. Decap BTLS tick. I'm gonna go ahead and stop the elbow.
You good.
Okay. Go ahead and check for distal pulse.
You do.
Do I have sensation?
You do. And you still have the lacerations.
All right. Go ahead and check this arm, decap BTLS tick.
Good.
Sensation.
Good. Still
Stopping
have
at the
lacerations.
elbow.
Still have the lacerations.
Okay, noted. I'm gonna have my partner take care of any secondary lacerations as far as the arms, the legs, and the head at this point. We're gonna continue ongoing assessment. Recheck will be done. Monitor every 5 minutes on the way to the hospital and end the skill.